Healthcare services are impacted by climate change. There is no doubt about it. As time goes by, and as we can see the effects of climate change hitting us harder every year, the burden on healthcare systems is unfortunately likely to increase. But at the same time, those same healthcare systems and the health sector as a whole is a heavy player when we calculate its carbon emissions globally, thus contributing to the problem of environmental degradation.
I would say it's a perpetrator, and it can move away from being a perpetrator. This is a report from Healthcare Without Harm that highlights that 4.4% of global emissions are related to the healthcare sector. That's more than aviation and shipping put together. This is outdated because the Lancet Countdown has said it's now 5.2%. So the rather alarming figure is that this is growing by 5% a year. And so we really need to be doing something about it. And often we focus a lot on buildings or transport, but in reality, there is a lot of emissions that are related to the stuff that we buy. And, medicines is often quite a big part of that. So the way that we might prescribe drugs or support people to be well matters.
It's a very big sector in the society's economy, but it's also usually the biggest employer in any territory. It's a bit a reflection on your question, victim or perpetrator. It's been paradoxical for these sectors to be actually a bit, for a long time, sitting on the bench regarding climate issues. It's been seen by many or by most, and even until now, as something which is for government or for citizens, basically, but not necessarily our own responsibility.
The Philippines is also located in the part of the world that is also a hotspot for climate-sensitive infectious diseases that can spark the next pandemic if we do not get our acts together.
We have every year 7 million deaths, premature deaths caused by exposure to air pollution. And not only the 7 million deaths, our hospitals are full of patients with chronic diseases that are extremely costly for the patients, for the society, but as well in terms of financial cost for our countries, for our health system. In particular, because we are already paying for it. I mean, it's, what the investment will require is already outweighed by what the health system is paying in terms of all the diseases that we need to treat.
Let us not forget that there is an awful lot of prescribing medicines that is not required, or where we're just prescribing on a just-in-case basis that we don't necessarily need, and a lot of medicines that are not necessarily, for instance, prescribed to someone, and then that could be reused by someone else. So we could be so much more aware of the way we utilize them. And in some countries, there's a lot of green prescribing going on. Actually, if we really go on this transition, and it will require everybody to go on this transition and this transformation, we will have to shift our financial models so that pharmaceutical companies are not necessarily paid per product or per pill, but actually are there to help people be healthy.
On the money issue, the thing is, yes, it will be hard, but it's not impossible. And we've seen already examples, for example, in Chile, where solar power is now cheaper than coal. In other countries, renewable energy prices are going down at a very fast rate. And I think what we are underestimating is the purchasing power of the global health sector if we actually all come together. I would love the funders of global health based in Geneva to sit down and devise a strategy for global procurement of commodities that are needed for low and middle income countries, and that can steer manufacturers and their suppliers of energy to also change their practices, their behaviors.
We think that maybe the best motivation for having more ambition, more motivation to be the engine of this climate change negotiation can be the health argument.
I would say the first stage, which is maybe between now and 2030, which is the first half of the reduction, is absolutely feasible and achievable.
Each of you very inspiring in your own and very different ways. I'm sure this will not be the last event that we have on health and climate change, and I hope you will help us in pushing the debate further here at the Institute and far beyond.